NBC News Wall Street Journal poll, more people would rather see health care stay the same than change under President Obama's plan. 41% want the bill passed, but 44% do not. Christina Bellantoni, senior reporter for Talking Points Memo, joins us now. Christina, thanks for joining us.
Hi, Tamron.
Hi. You know, part of the argument we heard from the White House is that health care reform, we needed it because people wanted it. What happened here? Is it the long debate? Is it the uncertainty and the back and forth and infighting within the Democratic Party? Why are we seeing these numbers now, you think?
Yeah, that has a lot to do with it. You know, certainly you ask any voter, you know, how would you rate what's happening with health care reform right now? What they see is a lot of stalling, a lot of give and take, and a lot of infighting between party members. But the bottom line here is that probably they are going to pass something. It's the details in that something that are really going to matter. And I think that that's where the Democrats, you know, stand the political risk. They need to really keep an eye on this for the 2010 midterm congressional elections. But, you know, once the American people see something passed, those numbers are probably going to shift a bit.
You know, and our colleague here at msnbc, Dylan Radigan, made a great point, I thought, earlier today that most people probably, because of their busy lives, simply can't tell you what's in this bill, and also because the message has been lost by a lot of the back and forth. I mean, when you talk to people and they're polled in this, they're voting reactionary, and perhaps by information they're getting from the neighbor or something they glance at on the news from time to time.
Oh, absolutely. There's all kinds of competing messaging right now. But you've also got a very important element here in that this bill is not actually completed and written. You know, I just came from a briefing with the Democratic Congressional Campaign Chairman, Chris Van Hollen, and he told reporters, hey, you know, don't forget that once the Senate is done with what it's doing, we're going to get another look at this in the House, and we're still far away from the final bill.
Right. And I want to play something the president said on World News Tonight regarding the country's future and how it is tied to the health care reform. Let's play that.
Your premiums will go up. Your employers are going to load up more costs on you. Potentially, they're going to drop your coverage because they just can't afford an increase of 25-30% in terms of the cost of providing health care to employees each and every year. And the federal government will go bankrupt because Medicare and Medicaid are on a trajectory that are unsustainable. And this actually provides us the best chance of starting to bend the cost curve on the government expenditures of Medicare and Medicaid.
So, Christina, some are calling, or critics are calling that a scare tactic by the president, saying that the federal government would be in such despair there. Is it a scare tactic, or is that the cold hard truth as this White House sees it?
Well, the White House is certainly, they also lob around the accusation of scare tactics all the time. So, you know, certainly it is to drum up a sense of urgency here. But, you know, if you look at the numbers, Medicare and Medicaid are a huge problem. And that's why you've got a lot of members of Congress very concerned about fiscal responsibility. And that's one of the reasons why you see the administration try to sell the health care bill as balancing the budget over the long term. And I think that that's an area you're going to continue to hear in the next few weeks before this deal gets done.
All right, Christina Bellantoni, thank you so much for joining us today.